Another important thing to keep in mind is that psychological symptoms frequently accompany concussion. Symptoms like anxiety, symptoms like depression, like frustration, like anger, irritability, all these things frequently accompany concussions. And really, they take people by surprise because they're not used to having these symptoms and they don't know how to talk about the symptoms because they're perplexed by them. It's important to share those symptoms because as soon as we can identify the anxiety, the depression, the frustration, the irritability, all of those things, as soon as we can identify them, we can do something about them because we have treatment approaches for all of them. One of the most important things I want you to take away from this is that concussions are treatable, that we can treat them, we can identify what the issues are, and we can help you get back to your normal functioning. You also need to keep in mind that by and large, most concussions resolve on their own within a relatively short period of time without any subsequent or later life issues. The sooner that we can identify what the issues are that you're having, the sooner we can intervene, the sooner you can go back to having a healthy and happy life, which is what we expect for all of you.